Hey everyone, welcome back. Today we're doing a deep dive on some exciting new Atogepant data.
Really interesting stuff.
I always like to cut to the chase for all you busy neurologists out there,
Yeah.
so
Yeah,
we'll get right into what you need to know about Atogepant for preventing migraines.
absolutely.
And, migraine is such a burden for so many patients,
Definitely.
and new preventative treatments are always coming out, so we need to stay on top of it all.
For sure.
We're taking a close look at this 2025 neurology study by Lipton and his team today.
Great study.
They analyzed data from not one, not two,
Huh.
but three
3.
phase 3 trials
That's right.
called Advance Elevate
Uh-huh.
and Progress.
All looking at Atogepant.
Exactly. And everyone's curious about how fast this works, really.
Of course, who doesn't want fast results?
Exactly.
Uh-huh.
So let's jump right in. So first, can you just give us a quick reminder of who was actually in these trials?
Absolutely. So Advance and Elevate looked at folks with episodic migraine. So they were having like 4 to 14 migraine days every month.
Gotcha.
And importantly, they had a history of migraine for at least a year.
Okay. Makes sense.
Now, Elevate was interesting because it focused on people who had already tried other preventive treatments.
Oh, so like the tough cases?
Exactly. 2 to 4 other preventives with no luck.
Wow. Okay.
Then we have Progress, which enrolled patients dealing with chronic migraine.
So 15 or more headache days a month.
You got it, and at least 8 of those had to be migraines.
Interesting. So Elevate is really like what we see in our clinics a lot, right?
Definitely reflects those patients who come in saying, nothing's worked for me,
Help.
right? They need options.
Okay, so just to be super clear, in all three trials,
Yeah.
they tested Atogepant 60 milligrams once a day
Uh-huh.
against a placebo
Yep.
in a double-blind design.
That's right.
So we can really be confident about these results.
Absolutely rigorous methodology there.
All right, now let's get to the good stuff. I keep hearing that Atogepant works super fast.
Yeah, that's one of the most exciting things about it.
So is it all hype or is there something to it?
Oh, no, it's real. Lipton's team actually looked at how many patients had a migraine on day 1.
Really?
Yep. And the results are pretty remarkable.
I'm on the edge of my seat here.
Atogepant significantly reduced the odds of having a migraine on day 1.
No way.
Yeah, across all 3 trials.
On day 1?
day 1.
Wow, that's amazing.
Yeah.
I mean, we're so used to telling our patients that it takes weeks or sometimes even months to see any benefit with preventatives.
Yeah, I know, right? It's a game changer.
So what kind of numbers are we talking here?
Okay, so get this. The odds ratios were 0.39 for Advance,
Oh, wow.
0.53 for Elevate,
Okay.
and 0.63 for Progress.
All statistically significant, I assume?
Oh, yeah, all statistically significant.
So this could really change everything.
Okay.
Can you imagine being able to give patients relief that quickly?
It's huge for patient expectations and for them sticking with the treatment.
Absolutely. My patients would be ecstatic.
I think so, too. And it also makes you wonder about how Atogepant is actually working compared to the older preventives.
Right, or like what's going on in the brain.
Exactly. Because those older meds take forever to kick in.
Weeks or months, right.
Sometimes, yeah.
Yeah.
But Atogepant seems to work in a totally different way.
Fascinating. So it's not just about the numbers, but what they suggest about the drug's mechanism.
Totally.
Now, day 1 is incredible, but we need to know if this benefit lasts, right?
Of course, that's the key question.
So what about sustained relief over time?
Well, Atogepant consistently did better than the placebo in reducing both weekly and monthly migraine days.
Really?
Yep. And this benefit was there as early as week 1.
Wow.
And it continued throughout the whole 12-week trial period.
So not only does it work quickly, but it keeps working.
Exactly what we want to see. And for those who like visuals, figures 3 and 4 in the paper really show this trend clearly.
So it's consistent relief over time. That's fantastic news for our patients who are just tired of dealing with these frequent migraine attacks.
It is. But it's not all about the number of migraine days, is it?
True. You're right, there's more to it than that.
It's about how those migraines are impacting their lives.
Okay, I'm intrigued. Tell me more.
So they actually went beyond just counting migraine days and looked at functional improvement.
Oh, interesting. How did they measure that?
They used something called the AMD.
The AMD.
Yeah, which stands for Activity Impairment in Migraine Diary.
Oh, right. The AMD. I've heard of that.
It measures how well people can do their everyday activities and how much physical impairment they experience.
And that's what really matters, right?
Exactly. Not just how many headaches, but how much they interfere with life.
For sure.
Yeah.
So what did they find with the AMD?
Well, the results were pretty encouraging.
Okay.
They saw significant improvements in both of those areas, starting as early as week 1.
So people were able to function better in their everyday lives within a week of starting Atogepant.
That's what the data suggests.
That's incredible.
It is. Imagine being able to tell your patients they might start feeling less limited by their migraine within a week.
That would be amazing. It could totally change how they view treatment.
Totally. It gives them real hope.
It's one thing to say, this might reduce your migraines over time,
Right?
but it's another to say, you might start seeing a real difference in your life within days.
Exactly. That's powerful stuff.
So did the study look at anything else besides the AMD?
Oh, yeah. They also use the EQ5D5L.
The EQ5D5L,
Right?
which reminds me, I need to look that one up again.
Uh-huh. Always good to refresh.
So what do they find with that measure?
This is where it gets really interesting.
Okay, tell me.
The patients taking Atogepant did better on both the EQ5D5L's descriptive system index and the visual analog scale.
Which measures overall health, right?
Exactly. And these improvements were seen starting at week 1 and week 2.
So we're talking about improvements in function, quality of life, and their perception of their overall health.
And all these benefits showing up early on.
That's remarkable.
It is. And what's really cool is that they used daily EQ5D5L assessments.
Daily.
Yep. Unlike some previous studies, this gives us a much more detailed picture of how Atogepant is affecting patients' day-to-day quality of life.
It's like we're seeing the whole movie, not just a snapshot.
Exactly.
You see all amazing stuff. It makes you wonder how these early improvements in function and quality of life might impact how patients stick with treatment and how satisfied they are with it.
That's a great point. We know that adherence to preventive meds is a big challenge in migraine management.
Oh, yeah, for sure. If patients don't feel like something is working, they're not going to keep taking it.
But if they start feeling better physically and in their everyday lives within a week or two...
It could make a huge difference.
Exactly. It gives them a reason to believe that things can actually get better.
Okay, so we've covered efficacy and quality of life, but we can't forget about safety.
Absolutely. Safety is always top of mind.
So let's move on to that now. What does the data tell us about Atogepant's safety profile?
Well, the good news is...
Good news is always welcome.
Right. The data from Lipton's study shows that Atogepant 60 milligrams once daily was generally well tolerated over the 12 weeks.
Okay, that's reassuring. But what were the most common side effects? Anything that stood out as particularly bothersome?
Actually, the most frequent side effects were pretty mild.
Like what?
Things like nausea,
Okay.
constipation, and fatigue.
Okay, those are pretty standard.
Yeah, and importantly, they usually didn't last long and didn't lead to a lot of people dropping out of the trial.
That's key. I mean, if a medication has a bunch of intolerable side effects, it defeats the purpose, even if it works well.
Totally. People just won't stick with it.
Exactly. And how does the overall safety profile compare to other CGRP medications?
It looks pretty consistent with what we've seen with other CGRP targeting meds, which is reassuring.
That's good to hear.
And for those who want to dive deeper, Table 1 in the study breaks down the rates of different side effects in both the Atogepant and placebo groups.
That's super helpful for reference.
Yeah, lots of good details in there.
Okay, so it sounds like Atogepant is a promising option for our patients looking for migraine relief without a lot of side effects.
So far, the data looks really good.
I'm curious about drug interactions, though.
Ah, yes, good point.
You mentioned earlier that Atogepant is metabolized by the liver. So does that raise any red flags for potential interactions with other medications?
It's definitely something to be aware of.
Okay, good to know.
Because it's broken down by specific liver enzymes, there's a chance it could interact with other drugs that are processed through the same pathway.
So we need to be extra careful when prescribing it to patients who are already taking multiple medications.
Especially those that could affect those liver enzymes.
Right. We don't want to create any unintended consequences.
It's always a good idea to dip check for potential drug interactions before starting any new medication.
Always good practice.
But it's especially important with Atogepant because of how it's metabolized.
You know, with all this talk about Atogepant's effectiveness and safety, it's making me think about how it compares to the CGRP monoclonal antibodies.
Oh, the MABs.
Yeah, they've been a big deal in migraine treatment.
They have, but they come with their own considerations.
Definitely. Like the injections and the potential side effects.
Yeah.
Not to mention the cost and insurance coverage issues.
All important factors to consider.
So how does Atogepant fit into this picture? Is it a direct competitor to the MABs or more of a complementary option?
That's the million-dollar question, isn't it?
It is.
This particular study didn't directly compare Atogepant to the MABs.
Okay.
But it did highlight some key differences that might influence our treatment decisions.
Like the speed of onset we talked about.
Exactly. Atogepant seems to work much faster than traditional preventatives.
Right. It even had a significant effect on day 1.
It did. Do we see that same rapid onset with the MABs?
That's a good question.
Not really.
Yeah.
While the MABs are very effective,
Uh-huh.
they usually take a few weeks to reach their full effect.
Okay.
So in terms of speed,
Yeah.
Atogepant seems to have a clear advantage.
That could be a major selling point for some patients.
Absolutely, especially for those who are desperate for relief and don't want to wait weeks or months to feel better.
Plus, it's a once-daily pill versus monthly or quarterly injections.
That's true. Some people might prefer the convenience of a pill.
Definitely. But on the flip side, the MABs do have a longer duration of action.
That's true.
So with the Atogepant, it's a daily pill, but with the MABs, patients only need injections every few weeks or months.
Right, so for some patients, the infrequent dosing of the MABs might be more appealing.
It really comes down to individual preferences and needs.
It does.
And of course, we can't forget about cost.
And insurance coverage.
Ugh, yes, the insurance.
The MABs can be really expensive, and getting them covered can be a nightmare.
Oh, tell me about it.
So how do you think Atogepant will fare in that regard?
Well, it's hard to say for sure since it's still early days,
Yeah,
but hopefully being an oral medication, it will be more accessible and affordable.
we can hope.
We'll need more real-world data to see how the pricing and insurance coverage actually play out.
Absolutely.
It sounds like both Atogepant and the MABs have their pros and cons.
They do?
And the best choice is going to depend on the individual patient
Absolutely.
and their specific situation.
Exactly. It's why it's so important for us as neurologists to stay up to date on all the treatment options.
Yeah.
And to really think about each patient's individual needs.
Personalized medicine is key.
Couldn't agree more.
But of course, no single study gives us all the answers.
Definitely not.
So what are some of the unanswered questions that researchers are still exploring with Atogepant?
Well, one big one is the long-term safety and efficacy.
Makes sense.
Hmm.
The trials we've been talking about focused on relatively short-term outcomes.
Yeah, usually just 12 weeks,
We need more data to see how Atogepant performs over longer periods of time,
months, or even years.
especially for a chronic condition like migraine.
Absolutely. Long-term data is crucial.
What else is on the research horizon for Atogepant?
Well, another important question is how it compares head-to-head with the MABs.
Ooh, that would be interesting.
We've talked about some potential advantages and disadvantages of each,
Yeah.
but a direct comparison would give us more definitive answers.
I bet those trials are already in the works.
I'm sure they are.
I can't wait to see those results. It'll be fascinating to see how these two different approaches to CGRP inhibition measure up.
Me too. And as more data comes out, we'll keep learning more about how to best use Atogepant in our practice.
This has been a fantastic deep dive on Atogepant.
It has.
I'm feeling much more confident about talking about this new treatment option with my patients.
I'm glad to hear that.
So is there anything else we should touch on before we wrap up this part of our deep dive?
You know what? There is one more point I'd like to make, and it's a
Oh.
little bit nuanced.
Okay, I'm all ears.
We've talked a lot about how Atogepant could be a good choice for patients who haven't responded to other preventive treatments.
Right, those tough cases.
But there's another group that I think could benefit too.
Okay, who's that?
People who are just starting preventative treatment for the first time.
Oh, that's interesting. Why would you consider Atogepant as a first-line treatment?
Well, because it works so quickly.
That rapid onset of action.
Exactly. That could be a huge plus for people who are new to preventatives.
You're right. They're often hesitant to try new meds because they've heard it can take weeks or months to see any results.
And that can be really discouraging, especially if they're already struggling with frequent and debilitating migraines.
Absolutely.
But if they start taking Atogepant and they notice a significant improvement in their migraines within the first week or two.
It could really motivate them to keep going with the treatment.
Exactly. And improve their adherence.
I like that. It sets them up for success right from the start.
Instead of having them struggle through weeks of uncertainty, wondering if the medication is even doing anything.
It's a great point. And remember, the safety profile of Atogepant looks really good,
It does.
which is reassuring for both patients and doctors when they're considering a new treatment. So we started by talking about how Atogepant could be a game changer for patients who have failed other preventives.
Yeah.
And now we're seeing how it could also benefit people who are just beginning their journey with preventive treatment.
It's a versatile medication that could help a lot of different migraine patients.
That's fantastic. It's an exciting time to be a neurologist specializing in headache medicine.
It really is. We have so many more options now to help our patients find relief from migraine.
And as we learn more about Atogepant and gain more experience using it, we'll be able to refine our treatment strategies even further.
And provide more personalized care for our patients.
This has been a really enlightening discussion.
It has.
I feel like I have a much deeper understanding of Atogepant now.
Great.
I understand its potential benefits and how it fits into the bigger picture of migraine treatment.
That's wonderful to hear.
So I think it's time to wrap up this part of our deep dive into Atogepant. But don't go anywhere. Stay tuned for part 2, where we'll delve into some case studies and discuss how to actually apply this knowledge to your practice.
Looking forward to it.
I'll see you there.
See you soon. All right, so let's talk about safety.
Okay, that's the big question, right?
It is. We know Atogepant seems to work, but is it safe for our patients?
Exactly. So let's dive into that safety data.
All right, so looking at Lipton's study, Atogepant, 60 milligrams once a day was generally well tolerated
Okay, that's good to hear, but over what time period?
over the whole 12 weeks of the trials.
Okay, so that's good news. But what about side effects? What were the common ones? Anything that we should be particularly concerned about?
The most common side effects were actually pretty mild.
Okay, that's reassuring.
Yeah.
What kind of mild are we talking about?
Things like nausea, constipation,
Uh-huh.
and fatigue.
Okay, so pretty standard stuff.
Yeah, pretty typical, and the good news is they were usually temporary.
Okay, so they didn't last too long.
Nope. And they didn't cause a lot of people to drop out of the study either.
That's really important. I mean, if a medication has a bunch of nasty side effects, people just aren't going to take it.
Exactly, no matter how well it works.
So how does the overall safety profile of Atogepant compare to the other CGRP medications?
It actually looks pretty similar to what we've seen with the other CGRP targeting drugs.
Okay, so that's reassuring.
Yep, no major surprises there. And if you want all the specifics, Table 1 in the study has all the data on the different side effects.
Oh, perfect. So I can check that out later.
Yeah, it breaks down the incidence of each side effect for both the Atogepant group and the placebo group.
Okay, very helpful. Now, you mentioned earlier that Atogepant is metabolized by the liver. Does that raise any red flags for us in terms of potential drug interactions?
It's something to keep in mind for sure,
Okay, I was thinking the same thing.
because it's broken down by those specific liver enzymes.
Right.
There is a possibility of interactions with other medications that are processed through the same pathway.
So we need to be extra cautious when prescribing it to patients who are already taking a lot of other medications.
Especially medications that affect those liver enzymes.
Right. You don't want to cause any problems.
Definitely. It's always a good idea to double-check for potential interactions before starting any new drug.
Absolutely standard practice.
But it's particularly important with Atogepant.
Okay, I'll keep that in mind.
Yeah.
You know, all this talk about Atogepant is making me think about how it stacks up against those CGRP monoclonal antibodies, the MABs.
Ah, yes, the MABs. They've really changed the game for migraine treatment.
They have,
Yeah.
but they also have their drawbacks.
Definitely the injections,
Yeah.
the potential side effects.
And don't forget the cost.
Oh, yeah, the cost and the insurance battles.
Ugh, it's a whole thing.
It can be. So where do you think Atogepant fits in?
That's the big question, isn't it? Is it a competitor to the MABs, or is it more of a complementary option?
I think that's what everyone's trying to figure out.
It's going to be interesting to see how it all shakes out.
This study didn't directly compare Atogepant to the MABs,
Right.
but it did point out some key differences that we need to consider. Well, one of the biggest is that speed of onset we talked about.
That's right. Atogepant seems to work much faster than those traditional preventive treatments.
And even the MABs.
It had that significant effect on day 1, remember?
That's right. Do we see that kind of rapid response with the MABs?
Good question.
Not typically.
Interesting.
The MABs are very effective,
Mhm.
but they usually take a few weeks to really kick in.
So Atogepant has a clear advantage there.
It seems that way, at least in terms of how quickly it starts working.
And for some patients, that could be a deal breaker.
Absolutely. Especially those who are really suffering and want relief fast.
Plus, it's a once-a-day pill,
Right, much easier than injections.
although the MABs do have that longer duration of action.
That's true. You only need injections every few weeks or months.
Whereas with Atogepant, it's a daily pill.
It is. So some patients might prefer the less frequent dosing of the MABs.
I can see that.
Ugh.
It really boils down to individual preference and what works best for each person.
And their specific situation.
And we can't forget about the cost and the insurance issues.
Oh, yes, that's a big factor.
The MABs are so expensive, and getting them covered by insurance can be a nightmare.
It can be a real headache.
So how do you think Atogepant will compare in terms of cost?
It's hard to say for sure. It's still early days,
Yeah.
but being an oral medication, Hopefully, it will be more affordable and accessible.
Fingers crossed.
We need more real-world data to see how it all plays out, though.
Yeah, we'll have to wait and see.
It seems like both Atogepant and the MABs have their pluses and minuses.
They do.
It's not a clear-cut case of one being better than the other.
So we really need to consider each patient individually.
Exactly. And choose the best option for their specific needs and circumstances.
That's what personalized medicine is all about.
Couldn't agree more. And that's why it's so important for us as neurologists to stay informed about all the different treatment options.
Absolutely. We need to know the latest research and understand the nuances of each medication.
So we can make the best recommendations for our patients.
It's a lot to keep up with, but it's worth it.
It is. It's all about helping our patients find relief and improve their quality of life.
Now, this study has given us a lot of great information about Atogepant,
It has.
but no single study can answer all our questions.
That's true. There's always more to learn.
So what are some of the things we still don't know about Atogepant? What are the unanswered questions that researchers are still exploring?
Well, one big one is long-term safety and efficacy.
That makes sense. The trials we've been discussing only looked at outcomes over a relatively short period.
Yeah, usually just 12 weeks.
We need longer studies to see how Atogepant performs over months or even years.
Exactly. Especially since migraine is a chronic condition.
So long-term data is really important.
It is. And another key question is how Atogepant compares head-to-head with the MABs.
Ooh, that would be a really interesting study.
We've talked about some potential advantages and disadvantages of each.
Right, but a direct comparison would give us much more definitive answers.
Yeah.
I'm sure those trials are already in the works.
I bet they are. I can't wait to see those results.
Me too. It's going to be fascinating to see how these two different approaches to CGRP inhibition measure up against each other.
Definitely. And as more data comes out, we'll get a better understanding of how to use Atogepant most effectively in our practice.
And how it fits into the overall migraine treatment landscape.
Exactly. We're still learning, but this deep dive has given us a great foundation.
It has, I feel much more confident about discussing Atogepant with my patients now.
I'm glad to hear that. It's an exciting new option, and it has the potential to help a lot of people.
Absolutely. So is there anything else we should cover before we move on to the next part of our deep dive?
You know what? There is one more point I want to make, and it's a little bit nuanced.
Okay, I'm listening.
We've talked a lot about Atogepant as a good option for patients who haven't had success with other preventative treatments.
Yeah, those patients who have tried everything.
But there's another group I think we should consider too.
Who's that?
Patients who are just starting preventative treatment for the first time.
Oh, interesting. I hadn't thought about that. Why would you consider Atogepant as a first-line treatment?
Because of that rapid onset of action we keep talking about,
I see.
it could be really beneficial for people who are new to preventive medications.
Because they often hesitate to try new drugs.
Exactly. They've heard it can take weeks or months to see any results,
And that can be discouraging.
especially if they're already dealing with frequent and severe migraines.
It can feel like there's no hope.
But if they start taking Atogepant and they experience a noticeable improvement in their migraines within a week or two,
It could really change their outlook.
it could. And it could motivate them to stick with the treatment,
That's a really good point. It sets them up for success from the beginning.
instead of having them wonder if the medication is even working.
And remember, the safety profile of Atogepant looks really good,
It does.
which is always reassuring when you're starting a patient on a new drug.
Absolutely. So we started by talking about a Atogepant thing for those tough cases who haven't responded to other treatments. And now we're seeing how it might also benefit patients who are just starting out with preventive therapy.
It's a fascinating medication with a lot of potential.
It is. It's an exciting time to be in headache medicine.
It really is. We have so many more options now to help our patients.
And as we learn more about Atogepant, we'll be able to personalize treatment even more effectively.
Well, this has been a really great discussion.
It has.
I feel like I have a much deeper understanding of Atogepant now.
Excellent. That's what we like to hear.
I understand its potential benefits and how it fits into the big picture of migraine treatment.
Wonderful. Well, I think it's time to move on to the next part of our deep dive.
Okay, sounds good.
We're going to delve into some specific case studies and talk about how to actually apply this knowledge to your practice.
Perfect. I'm looking forward to it.
Me too. See you there.
See you soon.
Okay, so we're back for the last part of our Atogepant deep dive.
We've covered a lot.
We have. We talked about how well Atogepant works
Huh?
and the safety data and how it compares to other treatments.
Now let's get down to brass tacks.
Let's talk about how to actually use this in our practices.
Exactly. So let's say you have a patient Let's call her Sarah.
Okay, Sarah.
She's been struggling with episodic migraines for years.
Okay.
She's tried a couple of preventive medications.
Nothing's really worked.
She's frustrated.
Understandably.
She's feeling hopeless.
I've seen so many patients like that.
And she comes in asking about this new Atogepant drug she's heard about.
What would you tell her?
Well, first I'd want to acknowledge her frustration.
Definitely make her feel heard.
Let her know that I understand what she's going through.
That's so important.
And then I'd explain that Atogepant is a new type of migraine preventive.
That works differently from the meds she's tried before.
Right. And I'd highlight the key points that we've talked about.
Like the quick onset of action.
Exactly. And the potential for a significant reduction in migraine days.
And all that data on how it improves function and quality of life.
But of course, we have to be realistic too, right?
Of course.
We can't promise that Atogepant is going to be a miracle cure.
We have to set realistic expectations.
It's important to explain that everyone responds to medications differently.
That's true. What works for one person might not work for another.
But I would also offer her hope.
Hope is essential.
I'd emphasize that Atogepant is a new possibility.
A new avenue to explore.
A new chance to find relief.
I like that.
Now, what about the practical stuff like side effects and drug interactions?
Ah, yes. Those are important considerations.
I'd be upfront with Sarah about the potential for side effects.
Transparency is key.
I'd explain that they're usually mild and they don't last long.
And I'd review her medication list really carefully.
Absolutely. Looking for any potential interactions with Atogepant.
And if there are any red flags, you'd adjust her medications or consider other options.
Exactly. And of course, we can't forget about the cost and insurance coverage.
Oh, yes, the insurance.
We talk about the potential financial implications.
Making sure she's aware of those.
Because we don't want her to be surprised by any unexpected costs.
Or to run into problems with her insurance.
Okay, so that's Sarah, our patient who's tried other preventives without success.
Right.
Now let's imagine a different patient. Someone who's just starting preventive treatment for the first time.
Okay, someone who's new to all this.
They're hesitant to try medications.
Worried about side effects?
And worried that it'll take forever to see results.
That's a common concern.
So how would you approach this conversation?
Well, I think it'd really emphasize how quickly Atogepant works.
That rapid onset of action.
Exactly. I'd explain that they might start to feel better within a week or two.
And that could make them more likely to stick with the treatment plan.
It's about giving them a reason to believe that it's actually going to work for them.
And that early success could build their confidence.
And their trust in the treatment process.
It's about empowering them to take control of their migraines.
I like that it's about giving them hope and a sense of agency.
You know, it's amazing how Atogepant seems to be a good option for both types of patients.
You're right. It works for people who have tried other preventives without success.
And it also works for those who are just starting out with preventive treatment.
It's a very versatile medication.
It really is. It's an exciting time to be a neurologist specializing in headache medicine.
It is. We have so many tools now to help our patients find relief from migraine.
And as we gather more data and experience with Atogepant, we'll be able to fine-tune our treatment strategies.
And provide even more personalized care.
Well, this has been an incredibly informative deep dive into Atogepant.
It has. We've covered a lot of ground.
I feel like I have a much deeper understanding of this medication now.
I'm glad to hear that.
I understand its potential benefits, its risks, and how it fits into the bigger picture of migraine treatment.
That's what we like to hear.
And I'm sure our listeners feel the same way.
I hope so. We've given them a lot to think about.
We have. So until next time, keep up the great work fighting migraine.
And stay tuned for more deep dives into the latest advances in headache medicine.
Thanks for listening, everyone.
We'll see you next time.